Okay, so what we're looking here are your vertebrae. These are from the low back, but they also are a good example for the neck in its healthiest stage and then different stages of degeneration. Now what we have are the bones called the vertebrae and these discs that are in between. Now people used to say the discs were shock absorbers, but that is not their function inside the vertebrae. We're going to look at this guy. This is a healthy one. When we maintain our disc height, the space or the tunnel where the nerve comes out from stays as large as possible. And we want to maintain those spaces open. Okay? We have different parts to that disc that we see. The first part is called the annulus, and this is a strong ligament-like fiber. And then there's the nucleus in the center, and this is the jelly-filled disc. Okay? What we see when we look down here is the spinal cord traveling through the canal down the middle of the vertebrae. Now what happens is when we herniate a disc or bulge or disc, that the material moves backwards into that canal space. Again, just like the spaces where the nerves come out through the sides, we want to maintain the spine space open as much as possible. So when we look at that MRI, we see that dark space, which is the spinal cord, and the white fluid around there. And then we see the level where you have the injury, that the spinal cord is actually pushed back up against the back of the vertebrae, and we don't have much water or spinal fluid in that area. This is the healthy disc. As the disc starts to dry up because of inappropriate motion of the bones above and below, not getting its nutrients, we lose disc height and we can start to impinge upon the nerve, causing pain, radiating pain, numbness, and tingling. As we look at the disc there, as we can see, there is a bulging where the disc has started to move back into the space, putting pressure on the cord, and there you see the redness, the irritation. This is from inappropriate of loading of these spinal segments. The joint, the disc, is not getting its nutrients because we don't get what's called imbibition, the bone moving up and down, pulls on the disc, and that's how it gets its fluid in, nutrients out. Fluids in, nutrients out. What we see at the level where you have your herniation is something happening like this. And what we have is the nucleus is now ruptured and is traveling out through the annulus. So there's a tear on these fibers, and the nucleus, is the jelly, is now traveling out of the donut, putting pressure back into the space, impinging upon a nerve. And here, what they're showing you, is that it's affecting this nerve. But yours actually moves straight back. It's mostly on the left side, but it moves a lot straight back. This is the fourth and final stage, complete loss of disc height. You haven't gotten to there. No more disc. All these bony, or what are called osteophyte changes, we get that in stage 3. And stage 3 is where that one disc area is at, where you have the herniation. So this is stage 4. This is what we want to prevent. Again, this is normal. This is the bulging discs. We're going to talk about this. This more indicates the level where you have your herniation. We see the bone spurs, we see the lipping and spurring happening, and what are these called? Osteophyte formations. This is stage 4. We have to prevent the degradation from this stage to this stage. You do have some other ones that are at this stage, the bulging versus the herniation. And now we're going to talk about that. So again, these are from your low back vertebrae, but it's the same example. We have the bone above and below, the disc in between. If I turn it on edge, again we have the body of our vertebrae, the spinal cord traveling through the spinal canal. Our disc gets nutrients by the up and down pumping motion. If we injure a joint or a joint stops moving, we don't get that motion, and we stop to get fluid in here, and it dries up. When it dries up, what happens is we start to get what's called a bulge. That is that the disc contents have moved outside its boundary area. So that's normal. We start to load, we start to lose disc height. That's what that bulging disc. The worst case scenario is when we have something herniate through, and that's what you have going down. Again, yours is traveling back through the center. It's on the left side but pushing back. But again, we have a bulging disc. When we're stepping on the jelly donut, we have a herniation, your protrusion, which is a tearing of the fibers that allows the center part, the nucleus, the jelly, to travel into the annulus, which are the outer fibers. This is what's putting pressure and blocking your spinal canal through this area. It's moving back and pushing this guy backwards, and it's also torquing it towards the right. Okay? That's what I believe is causing your pain. Bulging disc, stepping on the donut, herniation, the protrusion is the tearing and stuff is coming out. Bulge, protrusion, which is also known as a herniation. The goal of the spinal decompression is to start this motion again and try to suck that fluid that's caused that back into the space, reopening up your spaces, maintaining the spaces where your nerve roots exit, called the foramen. You have narrowing of these foramen more on your left side in your neck. We want to get the fluid to maintain the disc height, to maintain the spaces open here where the nerves come out, and also your spinal canal. Remember, we see it displaced down. This is the left of the MRI, this is the right, and we see it displaced to the right with the herniation down onto this side. I hope this clears it up a little bit more. Again, we want to maintain our spaces where the nerve roots come out from. We have a bulge in a disc. We have a tearing of the fibers. That's that herniation, your protrusion. It's putting pressure on the sac that contains your spinal cord. It's preventing the fluids that are in this chamber that give the nutrients to your spinal cord from getting there. So we run out of fuel. When we run out of fuel, we feel and perceive more pain. I hope you understand that a little bit clearer, the difference between the bulge of the disc, the herniation of the disc, what the therapies are going to try to accomplish, which is to get more fluid back into the disc so they maintain their height, maintain those spaces open where your nerve roots come through. We don't want to impede anything in that area. Hopefully this helps. Love you.